Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about lymphogranuloma venereum. Lymphogranuloma venereum results from infection by a bacterium called Chlamydia trachomatis, specifically the serotypes L1, L2, and L3. When I talk about serotypes L1, L2, and L3, serotypes is a way of classifying bacteria depending on the characteristics that they possess, especially on the outer surface of their bodies. I want you to look at this from a perspective of family settings. For example, in our different communities, we have clans, and then these clans have smaller families that form this entire clan. So the nuclear families in this context form the serotypes, and then the clan form the bigger group, which is in this context the Chlamydia trachomatis. Chlamydia trachomatis, the serotypes L1, L2, and L3 can enter your body through sexual intercourse with the infected person, and this can be through anal, oral, or vaginal intercourse. The commonly affected parts in lymphogranuloma venereum include your private parts as well as the lymph nodes, especially in your groin region or the pelvis and the rectum. The clinical presentation of lymphogranuloma venereum comes in stages, and these include stages 1, 2, and 3. In the first stage, the symptoms are going to come about 3 to 12 days post-exposure after you have been exposed to the infected person, or the symptoms can even delay about 30 days. So you're going to have these symptoms after 30 days post-exposure. And the first thing that will happen is you're going to have blister formation. That is formation of some small swellings, usually 1 to 6 millimeters in diameter, containing clear fluid, and they are going to be painless. When you touch them, they are going to be painless, and you don't have any pain coming out of those swellings, the blisters. You can as well develop some wounds, some sores in your throat and mouth. If you do not seek medical attention, that is treatment and investigations, you're going to transition to another stage, and this stage is called the second stage, usually 2 to 6 weeks after the symptoms of the first stage have appeared. And you're going to develop swelling of your lymph nodes, especially the lymph nodes of your groin region, your inguinal region. Sometimes you can also have swelling of the lymph nodes of your rectum and in the pelvis. The lymph nodes are usually painful, and when you touch them, they are warm. And after some time, the skin over the lymph nodes is going to erode, and this will cause a flow of pus from the lymph nodes onto your skin. You can also present with anal pain, abdominal pain, and back pain, as well as body aches, a feeling of you wanting to go to the toilet all the time. You're going to feel like you want to defecate all the time, and you're going to have body pains and fatigue. Some patients will also develop constipation, bleeding from the rectum, painful urination, fevers, and headaches. If you do not seek medical attention, that is diagnosis and treatment, you're going to transition to another stage, that is the third stage. And at this point, your symptoms have gone away. For example, you don't have sores anymore, you don't have blisters anymore. In fact, where those blisters were, you're going to have scar formation. But here you're going to have something more dangerous, that is a damage to your joints, your eyes, as well as your meninges, the sheath that covers your brain and your spinal cord. You're also going to have narrowing of your rectum, that is that part of the bowel that contains or stores the stool before you pass it out. It's going to be narrowed. You might also develop fistulas, especially anal fistulas, that is formation of a tunnel that connects the anus to the skin. You will also develop pus formation in various parts of your body, especially in your anal region, your pelvis, and your groin region, as well as enlargement of your private parts. The individuals at risk of developing lymphogranuloma venereum include people that have multiple sexual partners, sex workers, men that love having sex with other men, HIV patients, as well as people that are sexually active, especially between the ages of 15-40 years. So please, when you see such presentations on your body, I strongly urge you to show up to the hospital for proper investigations and treatment, because when you come to the hospital, we can initiate treatment, and 98.5% of the cases tend to respond well to proper treatment. But if you don't come to the hospital, you're predisposing yourself to complications. For example, damage to your lymphatic system, that is the system that collects fluid from your cells. And you're also predisposing yourself to other sexually transmitted infections, for example, HIV, herpes simplex, syphilis, gonorrhea. So please show up to the hospital so that your risk can be reduced, and of course to avoid complications. The investigations that we carry out in lymphogranuloma venereum include a culture and sensitivity, where we take off a sample of pus, looking out for any evidence of chlamydia trachomatis, especially the serotypes L1, L2, and L3. We can also do a Frey intradermal test. We can also carry out a nucleic acid amplification test, which looks out for the genetic material of the chlamydia trachomatis, especially the serotypes L1, L2, and L3. When it comes to the treatment of lymphogranuloma venereum, the following medications have shown to work. The first line is usually, the most appropriate medication is usually doxycycline, oral doxycycline, that is 100 milligrams twice a day for 21 days. The alternative can be azithromycin and erythromycin. If there is any abscess formation, we can do incision and drainage or just aspiration of the pus. We can also give you painkillers, because usually there is a lot of pain, especially from the lymph nodes. When it comes to the prevention of lymphogranuloma venereum, I strongly recommend that please let us all exercise discipline, responsibility, and accountability when it comes to our sexual lives. And this entails having one sexual partner and being faithful to that sexual partner. The most appropriate and best sexual partner is one you're legally married to. It is physically and emotionally safe, actually safest, when you're having sexual intercourse with someone you're legally married to. So that is actually the best sexual partner for you. Please also use condoms consistently and correctly. Sexual discipline, responsibility, and accountability also entails walking away from partners that are unfaithful, because it is not only harmful to your body, but also to your emotional well-being and also your mental well-being. So this comes to emphasize that please be faithful to your sexual partners, because when you're unfaithful to your sexual partners, you break their trust. You not only break their trust, but also the trust of your children. So please make sure that you value your marriages so that you don't lose the trust and respect that your children and your spouses had for you. Faithfulness to your sexual partner will also create a very loving environment for both of you and also your children. Sexual discipline, responsibility, and accountability also entails choosing the right partners for yourselves. For example, choose partners that hold similar values like you. For example, choose marriage partners that have the values that hold marriages together. For example, faithfulness. Because if you're someone that values faithfulness and then you're out here choosing people that are open to infidelity, for example, or they're open to having open marriages, you're not going to have good outcomes in marriage. Majority of the time, you're going to end up in a divorce. And remember, you want to enter into marriage to create a family for your children. And majority of the time, infidelity ends up breaking families, because when someone is unfaithful to their partners, they tend to lose their trust. They lose the trust of their children as well, and also the trust of their in-laws. So please make sure that you choose the right people for yourselves. And before you enter marriage, I recommend that first know yourselves, you as a person. Know yourself, know what you stand for, know your values, especially in a setting of marriage. If you value honoring your vows, being faithful, please choose people that are like-minded. Because even if you go through a series of marriage counseling, they will not work, because you're paired with someone who is completely on a different page with you. So I highly recommend that please know yourselves. You know yourself as a person. Know yourself as a person before you enter into a marriage with someone else. Because if you don't know yourself as a person, you don't know what you value, what you believe in as a person, and what is really important for you as a person. So I highly recommend that know yourselves first. Because if you don't know yourself, you're going to be paired with someone, and this other person might have different values, and this can be seen later on in marriage if you didn't take time to know yourself. The other thing that you can do is please inform your sexual partners, especially if you have been diagnosed with Lymphogranuloma venereum, especially if you had sexual intercourse with them in the past 60 days, such that they can get investigated and they can also be given treatment. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.